Nearly 6,000 scientists from around the world have come together to share the latest discoveries about potential treatments and therapies for Alzheimer's disease and other dementias. The Alzheimer's Association International Conference is where scientists are sharing scientific information that will lead to new methods of prevention and treatment and improvements in diagnosis and care. For people with Alzheimer's, Dr. Heather Snyder, Director of Medical and Scientific Operations at the Alzheimer's Association, joins us today. Doctor, thank you so much for being here. What do we need to know kind of right now to reduce the risk of dementia?
Yeah, some really exciting work that's being presented here at the Alzheimer's Association's International Conference suggests that healthy habits, the things like physical exercise, eating a healthy diet, dark leafy vegetables, keeping our brain active, not smoking, moderating our alcohol intake, and actually putting those healthy habits together, 4 or 5 of them can reduce our risk by up to 60%. But actually, even engaging in 2 or 3 of those factors or those healthy habits can benefit our brain health as well.
So how close are we to having a blood test for Alzheimer's disease?
We know it's so important to have a way of identifying, in an easy way of identifying an individual who may have the brain changes associated with Alzheimer's at the earliest time point. And research teams around the world are working towards a blood test for Alzheimer's and for related dementia. Today, we're further along than we thought we would be a few years ago. We'll probably first start to see a blood test being used in clinical trials in the not too far future, and hopefully not too long after that, we'll start to see this emerge in the clinic.
So why is sleep and the use of sleep medications an important topic at this conference?
Yeah, we see so much about sleep and the impact of sleep and its effect on our risk for Alzheimer's and related dementia. Some new science suggests that it's sleep, but also use of sleep medications that may impact our risk. Bottom line is, if you're experiencing sleep or sleep disturbances, have that conversation with your healthcare provider about how to treat and get ahead of those, because a good night's sleep is so important for brain health.
So the Alzheimer's Association offers a helpline for caregivers. So talk to me a little bit about what that helpline is.
We have a helpline that is available 24 hours a day, 7 days a week, all year round. It's staffed by master's level trained clinicians. And some new science that's being presented here at the Alzheimer's Association's International Conference suggests that one call is so beneficial at reducing the stress of the caregiver, of the family. You can reach that helpline at 1-800-272-3900.
What other resources are available?
You can go to the Alzheimer's Association's website at alz.org. There's a wealth of information about research, where the research is going, but also resources that are available in your community.
Anything else you'd like to share about the research that is being presented?
I think it's a really exciting time as we go forward. We're all a part of the continued progress, whether you're participating in a clinical trial, whether you're participating in your local walk to end Alzheimer's, or whether you're a scientist participating here at the Alzheimer's Association's International Conference. It's all of us working together that will ultimately get us to a way of being able to stop or slow the progression of this disease.
Well, very important topic for sure. Thank you so much for sharing today.
Thanks so much for having me.
All right, coming up.